This is chapter 35 of NUR 203, The Adolescent and Family. This chapter has a lot of objectives, and you can check these off as we go along if you like. We will cover all of them. The obvious physical changes are noted in the increase in physical growth and appearance of secondary sex characteristics. The primary sex characteristics are the external and internal organs that carry out the reproductive functions. Secondary sex characteristics are changes that occur throughout the body as a result of hormonal change but play no role in reproduction, like voice change, hair growth on the face for the guys, and pubic hair in areas for both, and then breast buds for girls. If you look on page 962 and 963, you'll see table 35.1 and 35.2 that have to do with Tanner's stages of development. So puberty, we have development of secondary sex characteristics, prepubescence period of approximately 2 years before onset of puberty, and then preliminary physical changes occur. Postpubescence is a period of 1 to 2 years after puberty, and skeletal growth is complete then, and reproductive functions become well established. So your primary sex characteristics, external and internal organs necessary for reproduction. Secondary sex characteristics result in the hormonal changes, voice change, hair growth, breast enlargement, and fat deposits, and they play no direct role in reproduction. Here's your sequence of maturational changes for both boys and girls. Then we have anterior pituitary gland adenohypophysis stimulates the hypothalamus to play a role in the male and female hormones that stimulate the gonads. The gonads then produce and release gametes, and the gonads secrete sex-appropriate hormones like estrogen in the females and progesterone and testosterone in the males. Tanner stages of sexual maturity are on pages 964 through 965. So you can see these pictures in your book. So, growth during puberty. Girls, they have what's called a thelarch, which is appearance of the breast buds. That's like pre-puberty. Ages 9 to 13 years. Usually means that you can expect after the breast buds appear that she may start her period within 1 year. Andriarch is the growth of pubic hair on the mons pubis 2 to 6 months after the thelarch. Menarche is initial appearance of the menstruation, approximately 2 years after the first pubescent changes. Average age is 12 years, 4 months in North America. Boys, the first pubescent changes are testicular enlargement, thinning, reddening, and increased looseness of the scrotum, and that happens between ages 9.5 to 14 years. There will be a penile enlargement and pubic hair growth, voice changes, and facial hair growth. Then there may be some temporary gynecomastia in about 1/3 of boys that disappears within 2 years. Vital signs and other bodily functions are more adult-like at this age, and they're developing Erikson's stage of identity. Early adolescence, group identity versus alienation, and then development of personal identity versus role diffusion. Development of self-concept and body image, sex role identity, and emotionality. Fourth and last stage of Piaget is the formal operations period, concerned with possible, not just concrete thinking. They begin to ask questions about other people's opinions so they can make an informed choice. Younger children in this age group will simply accept decisions made by adults, but the older ones will question everything and its relevance to society from their own moral values. They understand duty and obligation based on the reciprocal rights of others. Systems within the social environment, including family, peers, schools, and community, all contribute to an adolescent's development and health. There's much ambivalence during this social development stage, the state of having mixed feelings or contradictory ideas about something or someone. Spiritual development, consistent with developmental changes in value autonomy. The religious beliefs of young people are likely to become more personalized and less bound to the traditional religious practices that they've been exposed to as they were growing up. As adolescents mature and form identity, they may either reject the family's traditional beliefs or they may decide to conform to those beliefs. Relationships with parents. Since times changed recently to have both parents working, it seems that we have a lot more teens left at home alone and in the presence of their peers. Decreased adult supervision may result in more risk-taking behaviors and opportunities. Adolescents who feel close to their parents may show more positive psychosocial development and behavioral competence, less susceptibility to negative peer pressure, and lower tendencies to be involved in risk-taking behaviors. Emancipation from the parents may begin with rejection of the parents by the teenager. The old, "I hate you" every day from your teen, they don't really mean it. Relationships with peers, and I've encompassed the notes into this slide. Peers assume increasingly significant role in adolescence. The peer groups provide a sense of belonging and feeling of strength and power. They provide a measure of what's normal in your society that they're living in. They're with them at school or work and sometimes in your home. Interest and activities move to peer-centered, assist in development of their skills, and social media prominence. Again, we have to monitor what our teens are watching as well. Interest in activities, leisure activities usually revolve around their peers. Activities allow teenagers to set priorities and structure their time. Teenagers make use of social media, Facebook, Twitter, blogs, TikTok, what else is there? All kinds of stuff out there. Internet chat rooms can be dangerous. Social networking might be important to keep in touch with their friends, especially if they're discussing schoolwork. Cyberbullying is a big issue nowadays, so parents really need to know what their child is doing, who they're talking to online. Teenagers like to gather in small groups. Cliques are usually made up of one gender, and girls tend to be more cliquish than boys, with a need for a closer relationship as friendships go. Everything is a crisis in a teenager's life. For them, it really can be a stressful and life-changing moment, but we need to be able to talk them down and change the subject, or be able to bring them down to reality, back to reality, and understand that life will go on. If they fail a test or they lose a boyfriend, there are many more fish in the sea, and help them to just adjust. If they need a tutor or whatever it takes, give them some guidance and make it happen for them. Let them know it's not the end of the world. Physical fitness. Some teenagers are more physically fit than others and participate in sports, and others are just gamers and couch potatoes. We can try to change that if we set limits if you're home with them, but when you're not home with them, you have a little control over what they do, I think. Hypertension, hyperlipidemia, and immunizations need to be up to date, of course. Watching what they eat to prevent hypertension and hyperlipidemia, making sure they get lots of sleep and rest, which I don't think is a real issue with some teens. Optimum health during this time in a person's life can help ready them for the childbearing years. Hopefully it won't be any time in their teenage years. Appearance is very important to the teens, so braces may be applied at this age to straighten teeth and make their smile more beautiful. Deodorant and clean hair is very much noticed at this age, and because of the overactive sebaceous glands and apocrine glands, they are much needed. Scoliosis may be discovered and corrected at this age, and it's more common in girls than boys. Piercings and tattooing is an aspect of expression that many teens want to partake in with their peers, but I believe in the state of Florida you still have to be 16 years old with the parents' permission to get a tattoo. But piercings, I don't know. I don't know about that. Sunbathing, artificial tans, and tanning booths are important, and of course the teens will not think about the dangers because they're invincible at this age, or so they think, but we still have an obligation to teach them about the dangers of that. Many teens feel intense anxiety over their identity at this age. Some mature slower than others, while others mature faster than others, and this will give them stress either way. Finishing high school should be encouraged, but some insist on dropping out and going to work. Adolescents who drop out before graduating high school can expect to earn less in their lifetime than those who finish. At least that's what your book says, but we all know a lot of people who went into a trade without a high school education, and they make as much as I do, so it just depends on what route they take. Adolescents use being alone as one way to cope with stress. Healthcare professionals need to assess whether or not this is a sign of clinical depression. And you can see areas of stress in adolescence on page 974, box 35.3. Nurses who have the opportunity to teach adolescents about sex should stay on track and be clear and concise, using medical terms that they can understand, and do not use street language or evasive jargon. Explain that this is all about normal bodily functions and what can happen when you do not use protection should you decide that it's time to engage in safe sex. Give them information about sexually transmitted disease and what can happen if they get one. Show them pictures and talk about pelvic inflammatory disease and the possibility of infertility. The newly acquired ability to drive and normal developmental needs for independence and freedom make cars and trucks an attractive part of their lives in teenagehood. Dating and sneaking down to party with friends may or may not involve alcohol or drugs, but then you have talking on the phone and texting while driving. All of these things need to be discussed. Gun carrying among adolescents, they say in this text, is on the rise, especially in the inner city areas. And I guess if I think about it, it certainly probably is. You can see more about this on 976, box 35.4. We all know that the first thing we will do if a young lady has amenorrhea is to do a pregnancy test. If she complains about dysmenorrhea that's not common from her every month normal period, then you probably should suspect an infection of some sort, maybe like an STI, and have her go to a GYN for an examination. We need to teach both young girls and boys about breast self-examination and young boys about testicular self-examination. Gynecomastia may develop in a male child unilaterally or bilaterally, and this may be perfectly normal because of their prepubescent or pubescent stage of development. You can have them checked by a doctor if it becomes something of an issue to the child or you suspect that there might be anything other than that as a problem. One of my sons had this problem when he was in puberty, and he was very self-conscious of it, so he just wore a shirt when he went to the pool and stuff. Obesity is defined as an increase in body weight caused by accumulation of excessive body fat in relation to lean body mass. Obese, generally considered when the body mass index is above the 95th percentile for age, gender, and height. Overweight generally considered when BMI is between the 85th and 95th percentile. Proportion of obese children and adolescents back when this was written in 2018 was 17%. Effects of childhood obesity. Of course, it puts them at risk for adult obesity. It increases the chance that they'll get type 2 diabetes. It may give them hypertension, hyperlipidemia, and cardiovascular disease. They may have respiratory and orthopedic conditions. And it gives them a little on the side of social isolation because of the making fun of them by their peers. It gives them low self-esteem and sometimes depression. The etiology and pathophysiology has a lot to do with the family influence and their environmental conditions. Their diet is a major factor. Institutional factors, physical activity, how active are they, their appetite regulation, and psychologic factors. Diagnostic history, you want to take a careful history of their diet and their family exposure, skin fold measurements, a BMI calculation, body fat measurements, and diagnostic tests for metabolic and endocrine disorders. Therapeutic management would be prevention. Early recognition and prevention, maybe doing diet counseling with the whole family, nutrition counseling, behavioral therapy, a whole group involvement, family involvement, physical activity should be increased, and that would help with prevention. Anorexia nervosa, you can see on page 983, box 35.7 and 35.2 for characteristics of individuals with eating disorders. Refusal to maintain normal body weight, severe weight loss in the absence of obvious physical causes, primarily in adolescent girls and young women. The mean age of onset is 13 years and ranges from 10 to 25 years or more. Can be a life-threatening disorder. Many famous people have died from anorexia. Bulimia is the binge purge disorder. In older adolescents and young women, the eating disorder characterized by binge eating and then inducing vomiting or taking diuretics or laxatives. Rigorous exercise regimens, as many as 8 or more cycles of the binge purge per day. Eating disorders not otherwise specified are EDNOS, and binge eating disorders are BED, and you can see all this in your book. Eating disorders are psychological in their origin. What you put into your mouth may be the only thing you have any control over in your life. So she becomes obsessed with eating or not eating. So the cause is really unclear, but there's a distinct psychological component. Common initiator is dieting, relentless pursuit of thinness, distorted body image. I mean, they can be skinny as a rail and look in the mirror and they still look fat to themselves. The media has a big impact on this, and it's triggered by an adolescent crisis a lot of times. Therapeutic management, reinstitution of normal nutrition and reversal of malnutrition, resolution of the disturbed pattern of family interactions, and individual psychotherapy to correct deficits and distortions in psychologic functions. Nutrition therapy, refeeding syndrome, you can read about this in your chapters. Experimentation with drugs is normal for the adolescent. Drug abuse, misuse, and addiction are culturally defined and are voluntary behaviors, usually initiated out of curiosity, but then they soon realize that they may either be experimenters or compulsive users. This is where the parents must be vigilant and be there to help their children if they become addicted. This is just a list of some things that may be the types of things that are abused, not just by teens, but by a lot of people. Tobacco, Use has declined slowly since its peak in 1999. Tobacco smoking's been declining, but it's being replaced by vaping. So vaping is on the rise. That's all the rage now. Secondhand smoke has deleterious effects on health, and although the rate of smoking has declined over the past decade, smoking is still the chief avoidable cause of death. Reasons for tobacco use: imitations of adult behaviors, peer pressure, and some people actually claim to use it to control their weight. Less likelihood of smoking if the parents or family do not smoke, and less likelihood of smoking with high-performance sports activities. Here's your smokeless tobacco, which encompasses vaping or placing tobacco in your mouth but not igniting it, like chewing tobacco. It's increasingly popular. There are social hazards. It's a carcinogenic still, periodontal disease, tooth erosion, and soft tissue damage. Anti-smoking campaigns are for prevention, and the most effective ones are the peer-led programs. Nurses who have contact with children and adolescents are in an excellent position to provide information about substance abuse and serve as a patient advocate. Those nurses who care for these children and adolescents in the hospital setting must ascertain whether they are using drugs compulsively. Drug withdrawal can seriously complicate their illness. Nurses should be alert to the physical and behavioral cues of withdrawal or the effects of the drugs that they may be having while they're in this admission. Care management, interprofessional care management in the acute care setting and also in the long-term setting, family support, and prevention. Suicide. Suicide is a deliberate act of self-injury that causes death. Suicidal ideation is a preoccupation with suicidal thoughts. Suicide attempt is intended to cause death or serious injury, and parasuicide describes behaviors ranging from gestures to serious attempts. Talking about suicide in teens, the etiology says the individual, family, and social or environmental factors have been all indicated or implicated in suicide. The single most important individual factor is the presence of an active psychiatric disorder like depression, bipolar disorder, psychosis, substance abuse, or conduct disorder. Alcohol use in particular has been associated with a twofold increase in suicidal ideation. The motivation and methods, those are all individualized. Most of these teens will have periods of depression that go unnoticed because they keep it to themselves. They spend a lot of times in their room. Diagnostic evaluation comes after the fact. If they attempt suicide and they're unsuccessful, interprofessional care management is very important. And for us as nurses and parents, we need to remember, and especially teachers that are exposed to these teens, that no threat of suicide should be dismissed. If you hear a child talking about suicide, you need to make sure you bring that to the right people's attention. If you're not the right people, then you find the right people. Your question for this chapter says, Matt, age 14 years, seems to be always eating, although his weight is appropriate for his height. The best explanation for this is A, this is normal because of increase in body mass. B, this is abnormal and suggestive of future obesity. C, his caloric intake needs to be excessive. Or D, he is substituting food for unfulfilled needs? Well, Matt is 14, and teenagers, if anybody's ever had teenage boys, we know they eat an awful lot. So this would be normal because of an increase in his muscle and body mass. So that is normal. That would be A. And this concludes this PowerPoint. Thank you.